In Nigeria today, thousands of people have been lifted from poverty. More people have access to education, better health care, and improved access to potable water. The story of Hadiza Isiaka confirms the efforts of the MDG's office towards the success of all the 8 MDGs. Hadiza Isiaka can't really say how old she is, but here is Salimatu, her great-grandchild. They live in Kayarda village in Kuje Area Council of the Federal Capital Territory of Nigeria, Abuja. Hadiza was happy when this well was constructed over 33 years ago. Before that, she had to travel for miles to a river just to get water. We used to travel miles to fetch water from the river. Since this well was done, I find it easy to get water for my household. Today, Hadiza's joy knows no bounds as Kayarda village became one of over 800 communities that have benefited from the MDG's water project. For quite some time now, the entire village of almost 5,000 people had relied on the solar-powered borehole. And so, even Hadiza no longer uses the 33-year-old well but joins the other women to enjoy this new and cleaner water supply. Now that we have the tap water, everyone goes there. This well is no longer in use. The tap water is cleaner and easier to get. Progress in getting water to rural communities has helped improve the sanitation of the environment and promote healthier lifestyles. The promotion of people with access to potable water in Nigeria gradually rose from about 50% in the year 2000 to over 60% in 2006 and increased gradually since then. Although progress is slow because of the huge number of communities waiting to be served, the MDG's office has over the years used debt relief gains to increase investments in water and sanitation infrastructure. Public-private partnerships have also ensured a steady scale-up of initiatives, thus covering more rural communities. The task was to halve the proportion of people without sustainable access to safe drinking water and basic sanitation by 2011, and today, many are enjoying access to clean and safe water.
We're going to encourage investors to come and build factories within the country on a PPP arrangement, so that these drugs are produced within the country and we don't need to keep importing. That will reduce the issue of getting AIDS and all that, because we spend quite a lot of money on purchasing drugs from outside. If we make them, it's going to go a long way to reducing instances of no drug issue in the hospitals for HIV positive patients. The anti-malarials will be easily got, and tuberculosis drugs will also be available, as well as reduction in resistance. I know a lot is being done around DOTS, that's direct observe therapy for tuberculosis patients. I'm going to reinforce all that and work with the people concerned to see how we can effectively bring down the incidence or the prevalence rate that has gone down to 4.2 for HIV further down within these 4 years. And I think with every collaboration, I think it's possible. I'm equally going to collaborate with the Ministry of Environment and Water Resources in areas of sanitation and getting more water to the communities, because part of the things that were handed over to me was that the communities, most of them have boreholes now, but utilization is a problem. We're going to go on advocacy to make the community own these projects themselves. If they own it, they will learn how to use these projects that has been put in their communities. So all this everything is going to be a collaborative effort. We're setting out to do that to enable us achieve MDG rates, MDG successes by 2015.
Nigeria has recently received credit for integrating the MDG's National Development Plan strategy and leading the continent in introducing initiatives aimed at reducing poverty and improving public services. In the race towards 2015, the MDG's office now seeks to work hard with various partners to achieve the 8 Millennium Development Goals.